Welcome to the CSI TV Kochi 2016. I have with me Dr. Anjan Lal Dutta sir. Sir is the interventional cardiologist and the director for Peerless Hospital, Kolkata. Sir is also the past president for Cardiology Society of India. So welcome, sir.
Thank you.
I will begin with the general questions on the diabetes and IHD. How is the incidence of IHD and diabetes in India?
Yeah, you have raised the right point. In fact, India has the dubious distinction of being home to the highest number of diabetics and ischemic heart disease patients together. In fact, the incidence as of now is around 50 million ischemic heart disease and around 60 million of diabetic populations in India. So we have this important pride of being home to this number of patients. But that makes our job all the more difficult in terms of prevention.
Okay.
But at the same time, I must tell you, while we are talking about preventions and diabetes and other risk factors that is important, we must also concentrate on or think in terms of the patients who are already suffering from ischemic heart disease.
Right.
So we need to update our treatment facilities as well because we need to treat them, we need to save their life. So that is equally important. So while we are talking in terms of prevention, we must also concentrate or find measures to reach out to them, the poor people in the poorer segment of the society who cannot afford this costly treatment of cardiological interventions and others. So we must try to reach out to them and so that making the treatment available to them as far as practicable and force the government and the society to come out with help and so that with the minimum treatment cost they can avail the modern treatment of cardiology. Then come of course the prevention part. And here again I must tell you that we should just not do it as a lip service. We must be serious enough to see to it that we take care of all those factors that are known to us connected to ischemic heart disease.
Okay.
Bring about awareness in the populations, help them adapt the proper lifestyle. Because as against treatment, prevention doesn't cost anything. In fact, it may save your money.
Right.
If you don't smoke, if you don't take too much of alcohol, if you don't take too much of junk foods, it save your money. So we must take steps on that. So these are three important pillars I think we should be more serious about while addressing the whole problem of heart disease, particularly ischemic heart disease in India.